Excellent. Welcome everyone to our March Connecting the Dots meeting for the Maine State Breastfeeding Coalition. Really great to see you here. I look forward to hearing more from you. I'm seeing Nina has already dropped something in the chat box, and you are welcome to do the same. What I want to share with you now, I think you can probably see me copying this link, is a document that we will use during these meetings going forward. And some of you who have attended meetings before know that we've used it in the past, where we keep notes of different things that I try to keep track of that I plan on sharing during these meetings. And then you are also welcome to add to it so that everyone has access to this document to refer back to. If you remember us talking about an event or a research study or advocacy opportunities, this document is something that you all have access to. Hopefully, I know some folks, depending on your workplace, might not have access to Google Documents, so I apologize for that. And you can, hopefully, if you have access to it, can add to it as well. Nina is our board secretary, and she will be keeping notes as well. So if you have something to share, and if you're not able to type it in the chat box or in that document, you're welcome to just share it out loud with your voice, and Nina will do her best to capture that in our notes as well. So the plan for today for these Connecting the Dots meetings is to spend a few minutes to go over the agenda and to welcome everyone to the meeting. I'll spend a few minutes doing a quick board of directors update to let you know where we are at as a Maine State Breastfeeding Coalition board. And then we'll spend the rest of the meeting going around where you'll each have an opportunity to introduce yourself and share anything that you see on this list that you might have to share. So is there something legislatively you want to talk about? Is there anything else that's going on in the state or federally that you want to share? Any new research ideas that are coming up with? Anything that's happening in your workplace that you want to tell us about? Any events, any challenges, anything that you want to know? Is this also happening in your part of the state? What are you doing for it? What advice do you have? That's the whole idea of these meetings, is to connect with one another, to network, to learn about each other, and also to share new knowledge in any fashion. And then we'll wrap up the meeting, just going around to get a quick, what are you taking away from the meeting? And also to review any upcoming meetings or events that are good to know about. So that is the plan for today. Again, I'm going to just spend a moment moving some things around on my screen so I can see everything myself. Okay. And make sure I can access that. All right. So I want to start off by thanking our annual sponsors, specifically our patron partners. And if you are part of a business or an organization that might want to be one of our partners going forward, we'll be reaching out in the next couple of months to share some opportunities. One way that we recognize our sponsors and our partners is through what we're doing right now. So it's really good to get familiar with who is a supportive organization or business for the Maine State Breastfeeding Coalition. And that is also included in our newsletter if you want to see who else we have as partners too. So in terms of the Maine State Breastfeeding Coalition board update, as always, we're always looking for new committee volunteers. And to give you an idea of what our committees are working on, we have an advocacy committee that is right now really pretty focused on paid leave, organizing opportunities, education. We also are continue to work on donor milk advocacy and making sure that people have access to donor breast milk and that it's affordable. Our events committee right now is focused on the Patchwork of Parenthood event that is coming up in May in Portland. It's a storytelling event. And if you received our newsletter, we have included our call for stories, and I'll try to put that link, unless Nina is able to, in the chat box, link to our website where it has all the information about how to submit a story pitch. So if you are interested or know anyone who is interested in telling their story on stage in Portland in May, there are ways to submit that. So we're looking for any sort of story related to pregnancy, labor, birth, postpartum, infant feeding experiences. And we are receiving story pitches until March 20th. And that can be submitted through a form that we have, or it can be emailed to us in just a couple hundred words or a 2-minute audio recording. We've already received a few submissions, and it's always difficult to choose who the 6 finalists will be, but I think we're going to do something a little different this year where we'll make sure everyone has an opportunity to share their story in one form or another. So that is always a fun time of year for us to be planning that event. And we're always looking for people to help with that. So if there's anything that you would be interested in being a part of regarding that storytelling event, please let us know. And then World Breastfeeding Week will be following up pretty closely after that first week in August. We'll be planning something for that. Our workplace committee is working on toolkits. Right now, an employee toolkit for folks who are going back to work. How can they prepare for that? How can they communicate with their employer about their needs? So that's really exciting. That is something that we're working on a draft on. And then we might end up having some support if there's a physical activity and nutrition grant that is being applied for right now. And if we receive funding for that, if we are part of, if the state receives funding for that and we are part of that, then I foresee more workplace support being offered this fall and into next year. So fingers crossed around that. We also have our Diversity, Equity, and Inclusion Committee that is going to be developing a lactation education access fund. We raised some money back in November and December for that. So they'll be building that fund out for people who are from underrepresented areas, marginalized groups who would like to receive lactation education so that they can support people in their communities. So we hope to have that developed this year. And our communications committee is focused on newsletter development, social media, website updates, and blogs. Robin is here from our communications committee, and she is our fantastic blog writer at this point. And if you ever have a topic you would like to add to our blog, please don't hesitate to write one up and send that over to us. And Grace is also here. I see she's our social media guru. So thank you, Grace, for your participation on that committee. And it's a lot of work to keep that up. And then our fundraising committee is often part of our events committee. But if you have any experience with grant writing or see any grants or see any fundraising opportunities, then please, we could always use some support for that. And if some of those ways you can donate is through our PayPal charity page and also a Facebook birthday fundraisers. You've probably seen these, maybe you've done them. I've done them for several years and usually I'm able to raise between $300 and $500 or so. So it's a pretty easy way to raise some funds among your community and your friend and family group who know that this is the work that you do, is supporting new families. And so they might feel inspired to donate to the cause. And then, as always, volunteering is a great way to donate to the MSBC. So I will put that line. And when I see something come through that volunteer form, I connect with that person and meet with them and ask how you are interested in participating and volunteering, and we find an activity or a place for you to do that. So I would look forward to that conversation. All right, so I think that is it. Anyone else on our board here? I know Nina's here. Okay. Well, let's move on then and move into our new knowledge worth having portion of the meeting. And I will put these questions in the chat box so you can be thinking about what you might want to share. It can be anything related, not even related to those questions, but anything you want to connect on is great. I will quickly go through what I already have in this document, and then my plan will be to go through the participant list, and I believe it's in alphabetical order, and essentially call on each person and give you an opportunity to share. If you don't have anything, you can say pass, but it's your chance to connect with each other. So I hope you are still all seeing my screen. I believe so. And the document itself, I'll copy that again if you want to see it and interact with the document. There you go. The Best Connection Conference is May 11th and 12th. I don't actually have the link here for some reason, but that is something I could put in the chat box unless someone else finds it and wants to drop it in. And I will be facilitating a panel on Friday during that conference that will be focused on how policy impacts the lactation experience. And so we'll have panelists who will be able to speak to how hospital policies may have helped their breastfeeding experience, how workplace policies may have hurt or helped, or lack of paid leave policies, that sort of thing. So people will be able to speak to why it is important to be involved in advocating for good policy around lactation. This article, I don't know if anyone saw this research article about breastfeeding and how it's crucially important, but increasingly challenging, especially in our market-driven world. So that it talks about a lot of what we're already quite familiar with, which is the fact that the most common reasons for introducing formula and stopping breastfeeding is usually related to feeling like mom doesn't have enough milk. And the article speaks about why that is, what kind of messaging people are receiving to have those beliefs. And the last line in their summary is that breastfeeding is not the sole responsibility of women and requires collective societal approaches and take gender inequities into consideration. So it's a neat article, maybe something that's worth reading and taking back to your workplace. We have a space here for parent resources. So again, this is a great place for you to add any resources you have. Carrie Louch from WIC recently shared this one with me, We Care, and there are 2 E's, I believe, .co. Might want to double check that and see if that's working. But that, I know we're often looking for more childcare options for the families that we work with. So that would be good to look at. We have other resources in our own library. In terms of legislative updates on my end and being part of the Paid Family Medical Leave Coalition, the latest from that work is that the Paid Leave Commission report came out on February 7th, and they are reporting back to the Labor and Housing Committee on March 7th, and it will be pretty technical. And it will be related to what is, they'll be kind of including what is overwhelmingly unanimous and discussing what else to include in that based on what's neutral. So there's going to be some good discussion, not quite time for public testimony, but we hope that there will actually be a bill ready to be released. Thank you, Nina and Robin. We hope that there will be a bill ready to review and give testimony on at the end of March or early April. So stay tuned for that. And we'll be sharing lots of opportunities for how to get involved there. In the meantime, there are some other action steps to get the governor involved. The governor is not 100% on board with this at this point. She has some concerns. So we also want to make sure that the committees that will be hearing this, which is Labor and Housing, and also the Appropriations Committee members, will want to hear from folks about why this is important. So this is your chance to write letters to the editor and op-eds and also to contact any small businesses that you know. So governor's main concerns are going to be the upfront large cost to implement the program and deciding if that's something that should be outsourced or something that should be done within our own government. And small businesses, there are some concerns for small businesses, though I think that there are also many small businesses out there who see the benefit for their employees and for their own business, because costs are not going to fall completely onto the employer. It is a shared cost program and system, or that is likely what would be included in the bill. So I think the governor just needs to hear from more small business owners and from more people in general. There needs to be more people who are saying how important this is. And so you can speak from your own perspective or from this perspective of someone who works with families who have needed paid leave. And again, if you know of a small business, if you are a small business owner, maybe you are, someone in your family is, and you want to take a pledge saying that this is something you support, you can learn more about that there. And then you can also share your own story in a number of different ways. The Pump Act also passed, and so these links are here to share more about that. If you have questions, that second link that I'm dropping in there is an explainer. So what is the Pump Act and how is that explained? We'll also, our April 6th educational webinar is going to be a workplace law attorney who will speak a bit to the Pump Act and other laws that are helping and supporting families once they return to work. So it'll be really good timing to hear more from her about that. We are also going to be working with Mabel Wadsworth Center, Planned Parenthood, Maine Family Planning, Maine Women's Lobby, and Restore the Floor on a webinar April 11th, more about advocacy work. So if you're wondering how to get involved and why advocacy work is important, specifically to the reproductive justice and family care and breastfeeding, dispelling some myths around the legislative process, that is a webinar that we'll be sending more information about soon. I'll review some upcoming events at the end of the meeting. We have this section here for job opportunities. I know often we have folks who work in organizations who are hiring. And then I think the last thing I have to share is about this U.S. Breastfeeding Committee award program. So there's a conference that will be in Bethesda, Maryland in June. And yes, June 8th to June 10th, as we see right there. And they offer some different awards. So Emerging Leader Awards, Native Knowledge Awards, and Cultural Changemaker Awards. And if you know anyone who you think would be, who you would want to nominate for one of these awards, please consider that. And they could attend this conference for free. And it's a really inspiring part of that conference to see these awards given out. So I will put that link in the chat box as well, so you can learn more about that. Okay, so yeah, and I will return back to that at the end of the meeting. And now I would love to hear from you. I think we all want to hear from each other right now. So I'm going to go right to the participant list. And Nina, I know you already entered something into the chat box early on. I don't know if you want to share that again for anyone who may have missed that. That would be great. So when it comes to your turn, if you can introduce yourself and share either what part of the state you live in or what part of the state you work in, who you may work for if you are working for an employer, that would be great. And then anything else you'd like to share. So I see Alicia is up next on the participant list. So would you like to unmute and introduce yourself?
Sure, thank you. My name is Alicia Cutsley, and I used to be a Let's Go program coordinator, and I see Ashley on here as well. And now I work under Maine Prevention Network, and we are creating our new work plans. I'm located at Healthy Oxford Hills in Oxford County. And so one of the focus areas on our work plan is breastfeeding and trying to get more support and access for breastfeeding. So I'm really just here to listen and learn from you all. And I also have a personal tie with this. I am a new mom. I have a 4-month-old son. So I am currently in the thick of breastfeeding myself. So I have, personal interest in all of this as well. So thanks for having me.
Great, congratulations. And thanks for being here. It's been really exciting to hear about the work that is starting to happen more around the state with the partnerships. So thanks for being here and learning more and sharing as well. All right, Ashley, you're actually next on the list.
Hi, everybody. Ashley Edmondson. Sorry, I've been struggling with a cold for the last week or so. I am a program manager and I work at Maine Health in the community health department, and I manage the Let's Go community intervention. So the work that we do specifically with schools and school nutrition programs, early care and education, and out of school folks. We have collaborated with Kara before. She's helped to help create an online module for us for early care and education programs to take how to be supportive for breastfeeding moms in their workplace. The update I would include here is one thing we're about to embark on in the coming month or two is taking a look at our workplace tools. So we have a website that has tons of resources and information and access to training. And we are going to be looking deeply at our workplace tools. And I would love to be able to, in that process, connect with this coalition to figure out what's already created, what could we pull in terms of like we don't have anything right now in our workplace tools specifically to support a breastfeeding mom or breastfeeding parent to go back to the workplace. So that would be something on the radar. We haven't started the project yet, but and it's usually a lengthy thing, but I'm part of this network now, so I would certainly lean into this group of expertise in that process. So that's me. Thanks for the meeting. Yeah.
Yeah, thanks, Ashley. I don't know if the invite has been put out to you yet to join our workplace committee, or at least one of the upcoming meetings. I don't know, have you received an invite for that? I can send that to you. That might be a good opportunity to join our next meeting in particular.
Great.
Okay. All right. Thanks, Ashley. And Audra.
Hey everyone, I'm Audra Bushhagen. I'm the other side of Ashley on the Let's Go community health team. I work with the healthcare practices within Maine Health. So I'm fairly new to Let's Go. So to be honest, I'm not certain what my role here is yet, but I do work directly with all of the practices within the state and within Maine Health Medical Group and Maine Health. So I hope to learn more of what you all do and see how I can better support the practices based upon the information that I'm finding out from you. So if I can do anything to support you, just let me know. But thanks for letting me join. And I'm in the Portland region. That helps.
Okay. Yeah, Audra, have you met Sarah Austin or Paula Norcott yet?
I haven't. Nope.
And that's I was in Paula Norcott's role beforehand under the perinatal outreach and education program, which is based at Maine Medical Center, but funded through Maine CDC.
Okay.
And Paula does the breastfeeding specific work. And that perinatal outreach program is essentially the hospitals or birthing hospitals around the state.
Okay.
So Sarah would be a good person for you to connect with, and then Paula in terms of the breastfeeding work. And I can make a note to myself to introduce you.
That'd be helpful. Yeah, thank you. We're developing some tools to help support responsive feeding and in the practices. So and also at the hospitals if we can. So any connections would be great. Thank you.
Great. Awesome. I love these meetings so much. All right. Cynthia, you're up next.
I didn't realize I was next. I'm not ready. I want to phone a friend, please. No, I'm just kidding. So my name is, no, I'm teasing. So my name is Cindy Grass. I'm the public health nursing supervisor up in the Bangor area. We have a team of 6 nurses up here now. Last year at this time, we were at 1. So we are out there in the community, and all of them, with the exception of 1 right now, who is going to be taking her test in the next 2 weeks, are CLC certified. So that's a huge thing for us. So we deal with, across the state of Maine, maternal child health and also TB, but that has nothing to do with you guys, so I won't tell you all about that. But we have a group of nurses that are really passionate about what they're doing. They're in the homes. We're trying to get them in there prenatally, as opposed to, you know, when mom's coming home and frazzled and, and already climbing an uphill battle. So that's something that we're doing, and something we're focusing on right now. I wanted to bring up right now, that's just telling you a little bit about us. We are statewide, and I put in the chat over here, I put all the jobs they just posted this week. We're hiring public health nurses across the entire state. A lot of openings down in the Portland area. I myself only have one left on the team that I'm looking for, but we're looking for public health nurses all over the state. And as I said, a lot of focus for public health nursing is on maternal child health. Something I want to bring up today, is it okay, Kara, if I bring up, okay.
Sure. Yeah, is it possible is there a link where people could find out more about those jobs or to apply?
Yeah, so
Googling.
I thought the link was going to be added there, but it didn't. I'll go in and I'll find that link and I'll post it after.
Okay.
I wanted to bring up, I've been working with Erica and Jessica from WIC, and Jen from Bangor Public Health, and Kim from Maine Families. And I'm not sure how many of them are on here today, but I see Jen, and I thought I seen Erica. And what we're working on right now is, I'm not sure if anybody's heard of the Big Latch On. So it's a global event, and Kara brought it up in one of these meetings a few months ago, and I'm like, that would be an awesome idea. So instead of doing just in our territory, what we've decided to do is focus on the entire state of Maine. So that's why I've reached out to other partners to come on board and to help, and, you know, to actually organize this and promote it. So if anybody would like to, thank you, Kara. If anybody would like to be part of this, if you would like to promote it, it would be really great. There's nobody really up north in the county that I've reached out to, because I really don't have anybody other than, you know, our WIC partners and Maine Family up there. But it's going to be on April the 14th. It's going to be at 10:30 in the morning, and that's when we're going to do it. It's going to be a 3-day event, but we're going to do it on April 14th at 10:30. And what we're going to do is we're going to take all of the moms that come on to the Zoom link, which I found a Zoom link big enough, Kara, by the way.
Great.
Yes. And so we're going to take all the moms that latch on at that time, and they're going to click a button that says, I've latched on, and all our numbers will go towards the global total. So I'm pretty excited about this, but I would love, you know, if anybody has any input, Robin and Grace, I would love to pick your brains to see, you know, what you have as far as what you can do to help us promote. And yeah, so that's all I'm not going to talk anymore, Kara.
Talk as much as you want.
Yeah. So it's pretty exciting. It's like I say, across the state of Maine, and I think this would be a huge push for, you know, everything that Kara is trying to do right now, and really just put the word out there of, you know, what our mission is and what we're doing out there. Thank you.
Yeah. And one thing to clarify for those of you who aren't familiar with the Big Latch On, it used to be something that was in person and different throughout the world. People would get together, and like we did a picnic once or twice in Portland, and it doesn't have to be a baby latching on. It could be a breast pump latching on as well. So if you know of anyone who is who's pumping instead of directly breastfeeding, then that is also an option for them. There's lots of information on that website, and it sounds like different people are organizing it this year. It is usually during World Breastfeeding Week, or it has been in the past. It's kind of nice that it's going to be a different time of year. That it's not.
I think the virtual thing gives us so many other possibilities. Like, instead of just, you know, a selected few, it really, I want to call it the Maine Latch On, but apparently you can't rename it, but that can be our group. So yeah.
Yeah. So have you registered on the Big Latch On website yet, Cynthia?
Yes.
Okay, cool. Yeah. So once all the details are there, send that over, and Grace and Robin and I will put communications out through the Breastfeeding Coalition. And,
okay, perfect.
And then everyone can hopefully disseminate it among their own groups as well. Kind of like what we're hoping you'll do with the storytelling event too, to get that call for stories. We're a big state, and I think we are all somewhat spread out here, which is helpful. Awesome. Thank you, Cindy. Erica, you are up next.
Hi, everyone. My name is Erica. So I work for the Bangor WIC Clinic. I'm the breastfeeding coordinator there. So Cynthia shared a lot of kind of what we've been doing with the local coalition. So we do have a local breastfeeding coalition in like the greater Bangor area. So that's kind of what we've been working on with that one. But something else I wanted to share, something we did with Maine families recently, was a baby expo that Kim put on. It was kind of thrown together as like a resource center for people looking for like breastfeeding help or resources, kind of know what's in the area. So we joined her at that. It was a pretty good turnout. We were able to talk to some families. Our breastfeeding peer counselor went to be there with her. But we're talking about doing it again, hopefully in another time of the year, maybe next year, maybe later this year. But I think it's a great opportunity for families to kind of learn about resources in their area, since that's one thing. Not everybody's on WIC, not everybody's working with like Maine families or public health nurses. So I think it's really great for families to kind of get together and see what else is out there for resources. But yeah, that's kind of what we've been doing.
Awesome. Has anyone else here helped coordinate or participated in a baby expo? No? Okay, well, maybe someone, if you're interested. Robin, I see you had your hand up.
The local WIC here in Ellsworth had a baby event, and we met outside, and there were doulas and Maine families and stuff like that. It was a pretty small event, but every little bit counts. So we did it October, I think it was.
Okay. And Cindy, did I see your hand up as well?
Yes, we participated in that one that Erica was just talking about.
Okay.
Yeah.
Yeah, I think it's a great idea. And Erica, is a person you could contact if you're interested in organizing something similar. I bet you have some knowledge to share. Awesome. Thanks, Erica. Grace.
Hey everyone. So I'm a doula. I'm located in the Bridgeton, Maine area, and I'm a full spectrum doula. So I work with both postpartum and birthing families, and I work in a 60-mile radius of Bridgeton. So I'm in the Portland area, Lewiston a lot, Oxford. But the one thing I have to share today was actually just some research that I found that was interesting. One of my partner's coworkers actually recently just co-authored this study. And I also made a post about it that kind of summarizes it, but the study is, they have a 50-day free access to it. So if you guys want to read it, I can put the link in the chat and then you guys can definitely read it. But the study was looking at a postpartum navigation program specifically for people who are at high risk of severe maternal morbidity. And the results were really cool. So I just wanted to share that. I'll just go ahead and read some of the results. So the program that they did decreased hospitalizations for the participants for 20% for all causes, 43% for all causes, specifically for Black women, 56% for factors related to severe maternal morbidity, and 77% for factors related to severe maternal morbidity for Black women. So it was really cool. It seemed to almost help more with the people who are marginalized. So I thought it was a really cool study, and it's free for 50 days. So I'll put the link in the chat, and yeah, you guys can check it out if you are interested. And that's all I have to share.
Awesome. Thank you so much, Grace. It's helpful to know about different research like this. And it sounds like that was pretty effective. Those results sound really good. Cool. And maybe we'll try to get that in the shared document too. Awesome. Thank you. Jenny Doyle.
Hi, everyone. Thanks for having me. I'm Jenny Doyle. I work for Bangor Public Health and Community Services, and I'm a program manager for the Maternal and Child Health Home Visiting Program. So my nurses essentially do what Cindy's nurses do for the state, minus the TV. But we serve as contractors for the same Cradle Me referral system. So unfortunately, I've had my 2 really experienced nurses retire. So I just hired 2 really fabulous nurses who are training now, and I plan to send them to CLC training very soon because that's one thing that we really feel is just so important. But we do focus a lot on breastfeeding in our visits. I connected with that research article that you mentioned, Kara, because I've had 2 moms just this week who are really stressed about feeling like they're not giving their baby enough milk. They can't measure it, so they resort to the bottle or pump, and are afraid to just latch because they just can't measure that milk. So it's really hard to get them to understand that the more they latch, the more they'll produce, the baby will help with that. So that's been the challenge for me actually this week. But it's a great program. Cindy, talked about it. We love to see our families prenatally so we can just build that trust and get that relationship going and follow them through. And really our goal is to reduce infant and maternal morbidity and mortality. So we're picking up, we're getting busier, which is great, but we have plenty of capacity to take more.
That's great. Yeah, and do most people get referred to both of the public health nursing programs through Cradle Me, or are there other ways that you're getting your referrals?
It should be usually just through Cradle Me. It goes to one office and then they disperse based on who's covering which territory. So we cover the Bangor area. Cindy's 6 wonderful nurses surround us with coverage. And so yeah, it's the same Cradle Me. People call us and we guide them into how to fill out a referral form, or they can pick up the phone and call, or I've been known to fill out the form for them and send it in. So several different ways. Yeah.
Great. Excellent. Thanks, Jenny. Let's see, Kate.
Hi there. I'm a midwife, home birth midwife and lactation consultant, IBCLC. I'm located up in Kingfield, Maine. I'm relatively new to Maine. I just moved in July, but I lived here previously for 5 years. So I've been very connected to Maine for the last 15 years or so. I'm here mostly as a listener and to kind of see what's going on and network hopefully a little bit around the state. I do know Paula Norcott really well. She used to be in this area where I am now. I'm up in Kingfield. I don't know if I mentioned that. So I'm very north and I feel very lonely. So I think my biggest sort of issue right now is just kind of getting my name out there and figuring out who needs me and making sure they have access to me and that kind of thing. So I've tried to start a parent infant feeding support group in town. It's not really taking off, but I keep showing up. I do offer remote prenatal classes, lactation classes. It's free. I believe that this information is just lost knowledge. So I happily do a remote class for people, and people can just register through my email, things like that. I do it once a month, try to do it once a month. I was doing it pretty regularly in Vermont where I was practicing for the last 3 years. But things have kind of quieted down since I got to Maine. So yeah, I'm just happy to be here and kind of see some faces and see what work is happening in Maine.
You joined us and welcome. Thanks for being here.
Thank you.
Have you met Morgan before?
I haven't met Morgan, mostly through emails.
Okay.
I was just getting on the MACPM website and things like that, just to, promote myself, which midwives are terrible at in general. We don't have time for that.
Yeah. Oh, and there's also a new doula steering committee. What is it? I think it's called the Maine Doula Steering Committee. That's looking at how to best promote doulas throughout the state and increase awareness about doulas and increase education for doulas and about doulas, potentially looking at legislation down the road to increase reimbursement for doula services. So that group is just getting started. If anyone is interested in being part of that, you can send me a message and I can connect you in. And that could be another great way to network and get to know folks too.
Great, thank you.
Morgan, I'm actually going to go to you next and we'll come back to Lauren, who is before you, but I think it might be a nice segue into another midwife.
I'm Morgan Miller, a certified professional midwife based out of Bath, practicing with Soft Corner Midwifery. We have a new birth center that's open, which is very exciting. I also am on the board of the Maine Association of Certified Professional Midwives, like Kara was saying. I would say my only update is really, there's been some proposed legislature that's a work in progress, and so it's not fully defined, but it, as it stands, would include a reduction of the scope of practice for certified professional midwives in Maine, including a reduction of their postpartum services, which would highly affect lactation services. So we're all paying attention and trying to make sure that we can guard being able to offer those services for people. But that's kind of the only update as of right now.
Thanks. Morgan, if you can share that, keep me in the loop on that. And if there is a way that it does connect to our mission and our work, then we're happy to spread the word.
Yeah, I can. It's hard because there's only a placeholder for the bill right now, so I can share that number and the name of it, but there's not the written bill. We're working with those proposing it to try and make sure that we can guard the practices that are happening currently, but it is still pending. But I'll share a link of what it is right now, the number and everything.
Okay. And I received the Maine Association of Certified Professional Midwives emails. And if anyone else is interested in receiving those, is there a way they can sign up? And
yes,
I would imagine you would keep that news.
Yes, it's a great way to stay up to date with it. You can sign up for that newsletter from the macpm.org website, but I'll put a link in here too, or you can email me directly and I'll do it too.
Okay, great. And in the chat box, I see a couple people have asked Kate about, so Kate, you are in Kingfield. I can answer that question. And then Jenny was asking for your contact info. So I don't know if you see that in the chat box. If you want to share contact info in the chat, you're welcome to do that. And also Cindy is looking for Robin and Grace's contact info. So if you want to share that either with everyone or directly in private chats to Cindy, you're welcome to do that. Awesome. All right, Lauren.
Hi, everybody. There's three of us in the same room. I am a midwife also with Soft Corner in Bath. And I wanted to let folks know I am facilitating, we call it a new-ish parent social club. The idea is for it to be a community space for folks really who are anywhere in the trying to conceive, new parent about to have a baby or postpartum period, to just come together, hang out, spend time with one another. It's less of a facilitated support group space, although there is quite a bit of resource sharing that happens amongst folks. It's really, really wonderful to see. We've got a sweet group of folks going. It happens the last Friday of every month from 6 to 9 p.m. here at the Birth Center. And we actually rescheduled last week because of weather. So the end of February one is happening tomorrow night. If you have any folks who want to come join, I'll be here. And I did want to let folks know too, I am in charge of the events page on MACPM. And I regularly update anything. Like I feel like so many of us do or like sit on boards or are doing these things that are on the events page. But if anybody is looking for a really great hub of a place to access what's going on in the state, most meetings are open for anybody who wants to attend. So that's a great thing to keep on your radar as well.
Thank you. And I see, so Robin, Morgan put in the macpm.org site. So that's the site you're referring to, right, Lauren? But there's an events page. Okay.
Yeah, it generally gets updated at least once a week. And there's really cool stuff. There's a lot local to Maine, but we also put on bigger conferences that happen in the larger birth world all over the country. So there's pretty cool stuff to check out if anybody feels interested.
Awesome, thanks. All right. Robin, you're up next.
I'm Robin Snyder Drummond. I write the blogs for the Breastfeeding Coalition website. And I live in Ellsworth in down East Maine. So I'm in the county, sorry, Cynthia, but I am north. And I have a small, it's just me, birthready.com. And I work with Kristen Hayward. She's a CNM and DPN in Ellsworth. She has her own private practice and I do office consults in her office. And I can also do telehealth if people need that. So I'll make this brief. The Chamber of Commerce in Ellsworth has this grant program where they give you $1,000 to help grow your business. And Kristen wrote something to help her business and I wrote something to help my business, which is kind of us together. I've often offered prenatal classes for grandparents or prenatal people with your support people. And so my goal is to have brief postpartum preparation classes for families and those who support them. Anyhow, so we'll see how that goes. I find out tomorrow if we won the grant. I also offer tummy time classes in Surrey, which is one town over, and they really are mostly a way for moms or caregivers to get together with a little baby and meet other people. It's tummy time method, as I learned from Michelle Emmanuel, and it's for babies 0 to 4 months. I would say 1 month to 4 months, and it's free and it's a small group. We wear masks because of RSV for these little babies, but it's been a nice social event. I teach them some tummy time stuff and I talk to them about alignment and stuff like that, but it's really women getting together, exchanging phone numbers. So that's what I'm doing. Hopefully I'll get some publicity, and if I don't, I'll just keep doing what I do. So there you go.
Thanks, Robin. Thanks for doing what you do. Good luck with the grant. Would those classes be virtual or would they be in person?
No, they're in person. There's 4 people. It's a really nice space and they have this nice rug and they all have a blanket and it's really cozy and they sit down and they have time to feed and change diapers, but then we also do some tummy time exercises and then they have more time to feed and change diapers. So it's only 4 at a time. I do it every month. I just finished my last group and then I'm starting another group in March. I'll see. It takes a while. It gets my name out there. I go to pediatrician offices and give them a flyer, So that's
the one that you would offer if you get the grant. Would that one be?
Oh, that would also be, they would always be free.
And right or virtual. That one. The postpartum preparation class.
Well, right now I'm just doing them. My proposal was that people would meet in person in Ellsworth. It's also promoting the yoga studio as well as Kristen's business as well as mine. So I'm thinking the Chamber of Commerce is going to like that. local business. I didn't think of doing it virtually, but if I don't get money for doing these, I can easily switch it to virtual. Yeah, that's a good idea.
Yeah. Awesome. Thank you, Robin.
You're welcome.
Shauna, you are up next.
Can you hear me okay?
Mhm.
My camera's been messing up, so I wasn't sure. Hi, I'm Shauna Goulet. I am a labor and delivery nurse at Eastern Maine Medical Center. I am a CLC and a childbirth educator and a spinning babies parent educator. I work with Sarah Austin doing perinatal outreach all over the state at birthing hospitals and some of our rural communities like Rumford and other places that are no longer going to have labor and delivery, to make sure that the staff that is there is trained how to handle different obstetric emergencies and things. And I go in spurts where I'm able to come on for a couple of meetings in a row, and then I'm out because I'm, like I said, all over. I live up in Aroostook County and I work in Bangor, and I'm currently in Waterville at my daughter's. And I have another daughter in Wells. So I'm always up and down the state. I'm going to go talk with Cindy and her group coming up in April. I met her at a breastfeeding training that was in Augusta last month, and it was so cool to kind of get to know people. And Cindy, I hope you didn't get sick right afterwards, because literally 3 days later, I tested positive for COVID. I was like, and that was my first time. So I was like, okay, I've done good. I've got through all of this, and it was my turn. So, and it wasn't that bad, but still I was like, oh my gosh, I was in a room full of women chatting with people, nobody wearing masks for that whole day. And I was like, great. But I was bummed to hear that there'd been some baby expo things, because I've been combing the internet looking for anything local, and I could only find things from like 21 and 22 and 18. And because as a spinning babies parent educator, I love to get out there and teach women how to be more comfortable in their pregnancy from 20 weeks on, and have easier and more comfortable births. So yeah, I'd love to set up a booth and do stuff like that. And I don't know, I always like to throw out, are any of you familiar with the Count the Kicks campaign? Yay, it's amazing. And I'm trying to figure out, working with them. I met one of their reps at a training out in California for the Association of Women's Health Obstetrics and Neonatal Nurses, because I'm the state section chair. I met one of them out there, and it's like, how do we get this in Maine? Because if you're a participating state, then all that, the things that you can get, your posters, your cards, all the information is free to all providers. But Maine is not a participating state. They're not expensive things. I bought the little posters to put in our triage rooms at Eastern Maine, so that women that come in and just have a triage and go home, it's right there in the bathroom, and they can like scan the QR code and get the app on their phone. It's a very easy app to help them count the kicks. Gone kind of are the days of 10 movements in 2 hours is what we expect you to have. It's better for women, and it helps them be more in tune with their pregnancy, to be familiar with how often their baby moves and what kind of movements to feel and things. And it's lowered the stillbirth rate in Iowa, where it started, significantly. And our Maine statistics were the last tabulated year. It was like there were 64 stillbirths in Maine. And, you know, if we could lower ours by 20 by getting people to do this, it would be really amazing.
Wow. Thank you, Shauna. Morgan, yeah. I see you have your hand up.
I just recently signed up as a state ambassador for Count the Kicks through MACCM. And so I've been chatting with them a lot. There's been some past efforts to implement the program statewide in Maine, but of course funding is always the issue, and interest. But now that the studies have recently been published about the Count the Kicks method versus kick counting, that it's reducing stillbirth rates by 1/3. It's hugely significant. We're hoping to re-up the interest in it. So any parties interested, I would say affiliate yourself with the program, and let's get the state on board to implement it, because it's a really big deal.
Yeah, I printed up all the information, and I've done packets to give to each of our providers. So I've been catching up with like the lead providers in the different offices in Bangor. And I did one up in Presque Isle I had my annual physical and I was like, oh, can I speak with your office manager, please? And I had like my packet all together, and she was like, oh yeah, we looked into that once before, but everybody has their own choice of how many kicks. I'm like, no, here's your evidence. I'm giving it to you. This is what I need you to review again, because this is totally different than, oh, this provider says do 8 in this amount. This one says do 10. I mean, that's why we're trying to, do this. And you can't tell me that our birthing families right now are not all about the apps, because they are.
And it is an incredibly culturally friendly app that's for like nearly every language that exists. It's completely free. And so it's really about finding funding to get physical resources everywhere in the state so that people can scan that QR code and do the thing. It's quite a simple but effective program.
Yes.
That's awesome. This is really great to learn about. Thank you both for sharing. And I would recommend, I think you both might be connected to the Perinatal Quality Collaborative for Maine, PQC for me. That might be something that's worth sharing with the organizers and seeing if that is a QI project that could be taken on, that could be created and taken on and potentially funded. Sounds like it would fit pretty well. Awesome, thank you. All right, and Sierra, you are last but not least, unless I've missed anyone.
Hi, I'm Sierra, also with Soft Corner. I think we've pretty much covered it. The only other update we have is that we are looking for an IBCLC. We're based in Bath and serve about an hour, and like to have in-home care for folks in the postpartum time. So our clients get an IBCLC visit, and we're just looking to cover more of our travel radius. We know there's, a little more north. We know there's like a pretty big shortage of IBCLCs around here, especially those who are queer and trans affirming. So just put the word out, send people our way if that is part of their interest.
Great. Thank you, Sarah. Awesome. Thank you everyone for being here today and for sharing so much great information that we can all benefit from. I'm going to put a couple more links in this last minute that we have. I already shared a little bit about our storytelling event, and now is really, as I mentioned before, a great time to be spreading the word. If they're local to the Portland area or local enough to want to travel there to tell a story, please spread the word. We want to get as many stories, as many diverse stories as possible. So we'll be doing a lot of outreach to different organizations in the area too about that. And then we have, I'm going to do a quick screen share of different events that are coming up, and also put this link in the chat so you can see we have a busy spring and summer coming up. Our next month meeting will be an educational webinar. I mentioned we'll have a workplace law attorney speaking about expressing milk for your child at work, what helps and what stands in the way. That'll be a fantastic webinar. I'm looking forward to that. The Global Latch On is coming up. Our next Connecting the Dots meeting is on May 4th, and that will be our annual meeting. And so that is the first half an hour is going to be on us really giving more of a thorough update on where we've been and where we're going as a coalition, and then spend the remainder of the time doing this sharing that we've been doing right now. And the BEST conference I mentioned, we have our Patchwork of Parenthood I mentioned, the USBC conference in June. If you're planning on going, if your organization is going to send you to that, let me know. I'd love to plan on seeing you there. And then we are hoping that our next Connecting the Dots meeting, so June 1st, we have an educational webinar about breastfeeding. Breastfeeding in human milk is not the title of that. I think it's like the microbiome is what the focus is going to be on that. And then our July 6th in Connecting to the Dots meeting, we would really love to have in person. If you have a location that you think we should all gather in that is central enough for a majority of folks who are interested, then let me know. It'd be nice to have some sort of a picnic or some kind of a gathering in July when the weather will hopefully be nice. So that is it for me. Thank you all for coming today and sharing, and look forward to seeing you next time, and enjoy the rest of your day.